Hi, I'm Dr. Daniel Farrier, a physician in the state of California, and I'm the head of the Medical Advisory Board of Intel Bioenergetics in Encinitas, California. And we have collaborated with John Thorp, who has pioneered and also been the ultimate clinical developer of what is referred to as the Electro Equiscope. The goal of what we're doing with this approach to helping patients get better across generations and across a wide variety of clinical presentations is to enact a fairly brief but very effective ability and therapy to increase metabolism and reduce the amount of pain that someone has with all sorts of acute or chronic injuries, and also metabolic conditions, including fatigue, etc. So joining me today is one of the fellow advisors on the advisory board for Intel Bioenergetics, and that's Dr. Richard Delany from Boston, Massachusetts.
My name is Dr. Richard Delany. I'm a clinical cardiologist and internist in private practice in Boston, Massachusetts. I'm board certified in internal medicine, cardiology, critical care, and geriatrics, and certified in functional medicine. I've had this opportunity over this past year to use this remarkable equipment firsthand on my patients. I'm able to do a history and a physical examination and determine where in the body there is pain and think about the mechanism of how it got there and how I can prevent it. And then I use a non-invasive microvoltage technology that reduces pain, improves function, and is lasting for the patient. It's simply remarkable. I've treated patients from knees to backs to shoulders to wrists and systemic fatigue. And the protocols developed by John Thorp and Dr. Farrier, when implemented by a physician who's trained simply in this technique, is outstanding. To be able to take a patient who has pain and no treatment option other than something invasive and give them a 45-minute, 50-minute treatment and have them walk literally out of the office with less pain, it's amazing. And it makes me a better physician. So it's been an amazing journey, and I thank John Thorp and Dr. Farrier and this machine between us.
This device has such a broad application in so many type of disease processes, be it musculoskeletal, neuromuscular, pure neuropathic type problems in the lower extremities, to name a few. We have ventured for years in using this for anxiety, depression, mild anxiety, mild depression, to help people buoy them up into a different state of health and a different state of mind. So the clinical application of the device is extremely widespread. It can fit multiple types of specialty practices, from those who concentrate on neurological problems or perhaps musculoskeletal only or both, and or internal medicine problems in general. To look at this as a device that helps pain is truly an understatement, because whether someone is pre-op or post-op, this device can intervene. Now, we boast somewhat about the efficacy of this device on so many types of clinical issues and clinical problems. The device can pick up and find out what the status of the tissue is, meaning what is the electrical signal going through that particular tissue. By doing so, we establish a baseline of what the tissue, where the tissue is. And then the machine immediately processes that, and it provides a corrective waveform or corrective amount of current and or voltage together to help bring the homeostasis back to that local tissue. The most important aspect of this is it does it extremely fast, namely perhaps at least 1,000 times per second. It is taking a snapshot of what is in the tissue, goes into the device, and the device, with relative artificial intelligence, determine what's missing, and as a result it corrects it back to normal with regard to what the charge should be. And that is the advantage of a device that has more than just a one-way application, from heat or from vibration or from manual manipulation. All these things are usually directed one direction, namely from a device or from something or someone externally. Usually a one-sided attempt to rectify the tissue somehow, rectify the problem. So with that, we have the advantage then, through this device, to have a two-way exchange where we're not impressing anything on the body, but it's telling us every time what its response is to the last time we treated. Take a picture, figure out what the deficit is, come right back and deposit that amount right then for that microsecond, and try to correct what's going on with that tissue's imbalance. And with that in mind, we are correcting the entire time. When you do this accurately and adequately, what happens is that the tissue will start to have regeneration of its more normalized type of function, and then we depend upon the body to take care of that.
As a physician who's been utilizing this technique that Dr. Farrier just designed, what's so unique about this technology as you deliver the voltage, the micro voltage, non-invasive, painless voltage into the patient. The machine tells me whether I've achieved success, whether I've cleared the blockage. If not, I stay until I clear it, and we go to the next frequency. So it's not like giving ultrasound not knowing what you're doing. You put in the micro voltage, you see whether the impedance or the blockage has been cleared, and if it hasn't, you stay there and you move it along and you adjust the gain or the intensity, and they clear, and then you go to the next frequency. And it's a thinking man's machine that allows you to non-invasively allow a patient to heal. Magic. When you finish the treatment, you ask the patient to get up and walk or move the part that was bothering them. And almost instantly, it's better. A smile comes on their face as they walk down the hall if it was a knee without pain or a shoulder. It's simply amazing. And the machine told me that was going to happen because I successfully cleared it based on the protocols given to the practitioner on how to use the machine.
So again, my desire is to ensure that the patient and also the potential practitioner that uses this device understands that it does work as fast as we've talked about, but that there are also long-term problems which have a limited amount of benefit in the very beginning, but over a period of time it continues. And what the whole issue is here with regard to people desiring something to happen very, very quickly, and when they see it happen to someone else on a knee or so, then why doesn't my chronic back pain go away when I've got a major crushed disc, etc.? We can help alleviate the pain from the disc, but obviously the device doesn't automatically correct that the disc itself. Now, over a period of time, we know that we can still work on this to some degree and find out what level of pain relief we can give. And we've got some dramatic stories. Everybody who uses these devices has a dramatic story of how, even with back pain, even with some squished discs, so to speak, that we can actually intervene and help somebody become more functional. But it also has to do with the fact that some diseases are more chronic than others. So that brings us back to how the device works. And the device simply deposits charge. It puts so much microcurrent in over a period of time. The key, however, is it's not going in straight in like a square wave like this, on, off. It actually has a sine wave, but these are very high frequencies. And because they're high frequencies, they can deposit charge very, very quickly in certain areas, and the frequencies each can have an effect based on its own application to the body. When we look at who got better and how fast it took them to get better, we're going to do for the body what it has never seen before. And I emphasized that to someone recently. We were helping someone with a problem of some of the sympathetic chain or the autonomic or the automatic type of response of the body firing as it's supposed to, and it didn't fire quite right, and it creates all sorts of symptoms of perhaps blushing or sweating. And so we're not sure exactly how it's going to help that tissue, but we know one thing: as much as it helps the ankle that's sprained, it's going to deposit charge, and it's going to immediately figure out what's missing, what's not missing, and within the next 10 or 15 minutes, we can change that particular dynamic. Again, how do we know who gets better first or last? It doesn't matter. What matters is we understand, and this is what I wanted to certainly convey to everyone of whatever level, from patient to practitioner, and that is, we can't make any guarantees. Yes, we have some phenomenal results with this. We always have. We're going to do whatever it takes to put that cell's metabolism back, because we're putting the electric current and the charge back into the cell. When you do that, the cell will work better. And it may not work better initially, like some people have very, very fast responses. It may take a period of time. How do I know that I'm going to affect this neurological problem with those type of very severe symptoms that somebody would have? How do I know I'm going to be able to actually affect that very quickly? I don't. But I do know I'm going to give the body the first chance it's ever had of having cells optimized with regard to what their electrical charge is. If we keep doing that over time, then I like to be fair and say, yes, in a short period of time, this happened. But perhaps, as it is with a lot of healing experiences, let the body heal itself. It may take a little bit of time, and it may take a few weeks, and it may take a longer period of time. So what I like to say is that this device delivers a charge in a way, two-way exchange, multiple waveforms, concentrating on exactly what the problem is, correcting those, putting it back the way it's supposed to be for this amount of time, and then this amount of time, and that amount of time, and then we let the body do its own thing with regard to healing. When we do that, I'm not going to sit here and say, I don't care about how long it takes for someone to get better. But I will tell you, as a physician, as a medical doctor, if I have a tool that I know is going to allow the tissue itself to heal it without, in this case, any type of invasive procedure, I'm really excited. I'm very, very excited, because then I know that there is a true possibility of making the benefit last longer and longer. Now, the final point on having practitioners and patients understand is that when you build the charge up, it doesn't automatically disperse all of a sudden. When the cell works better, it becomes healthier. If you put more charge in, it keeps it healthy. Now, what happens after you have physical therapy, after some back sprain, etc.? Don't you eventually, most people, if we at least on an outpatient basis, don't we see people getting better to some degree? Why are they getting better? Because the healing has taken place. Our goal is to introduce the healing up front and then let the body take over and let the body heal. And that's why when we say we do a bunch of therapies in the beginning, short or longer, 2 or 3 days or 2 or 3 weeks, after which then we make the decision clinically twice a week for the next 3 or 4 weeks. Let's see what happens. Twice a week for the next 2 months. Let's see what happens. Then the patient and the physician, the practitioner, are totally involved with a wellness model rather than just disease-specific model. And as a result, this is a tremendous tool. And Dr. Delany, don't you have cases like this? I know I do, but I want to have your experiences.
As I'm listening to Dr. Farrier talk about this, because we believe the mechanism, when you put this microvoltage into an area of disease or pain, that those channels at that location are blocked. Mm-hmm. And this machine gently opens them. And and I think it entrains it. You put a couple of treatments in, it stays, it backs down again, and finally and then the body, as you said, heals. Mm-hmm. It does it itself. Mm-hmm. And so if you wanted to Google cell ion channels, you would see it. But I think this whole concept of what you said, we approach the patient the same way. Mm-hmm. And, I think about, I'm a cardiologist and I read EKGs. Neurologists read EEGs. We use electricity to diagnose, and here and now I'm using electricity, microvoltage electricity, not felt by the patient, mm-hmm. to open their ion channels, bring them back to an area where now the body can heal itself. Mm-hmm. Now, I didn't know that a year and a half ago. And I not only know it, but I can see myself at home, back at my office, doing this to individual patients as they smile, and I smile as we get them better. As an adjunctive treatment. It doesn't replace things. It adds to my ability to help patients.
And that's the whole concept of integrative medicine, is that we're trying to integrate multiple modalities as we can. And this is easy to incorporate, like I said, from setting it up in your office to the actual application of this, to the simplicity of putting a couple probes on someone or plating someone to achieve the type of results that you're talking about. And so there's a pleasure principle that goes with this. As a physician, we look at something where we've done a lot of things in the past. As we integrate something else, we know now perhaps what we've done before will work even better.
This is the best kept secret right now.
Okay.
It's the best kept secret in clinical medicine, and it's a no-brainer to help this.
What we'd like to do, to the credit of John Thorp, deciding that he wants to expand this somewhat, and with our help from medical side, is that what we try to initiate in the understanding of this device is to give a demonstration. Because when you demonstrate on something that's injured or someone that's injured, from a pet to your uncle or your child that fell down, from a major bruise or from a minor scratch or from a fracture, etc. One of the opportunities that we want to make possible, and also the primary modality that we want to impart in this regard, is to demonstrate on someone and show the efficacy, and then talk about what we're going to do with regard to how this might help you down the road. And I think that most practitioners that actually have incorporated this into their practice have the same approach, because, as you say, it's the best kept secret, and it has been for about 35 years because it hasn't been expanded with the type of, I think, medical support. Do you agree with that?
Yeah. And the simplicity of it takes away a lot of the complexity.
Mm-hmm.
I mean, the function is you put some gels and probes or plates on a skin. The most the patient feels, if anything, is a little tingling. And we go through protocols. They're there for 30, 40, 50 minutes, depending upon. And then they come back another day and they get another treatment, 2 or 3 in a row. And after 3 treatments, everybody's a little bit better. Some dramatically.
Yes.
And some, my gosh, I don't have to take my Motrin anymore. I don't have to, and it's amazing. It's amazing technology.
This can generate revenue very nicely, and the thing is, it does it in a way which your patients are, I would say, 95% extremely satisfied.
You can become proud.
Mm-hmm.
Proud to be able to offer this to your patients and your staff. Of course you can. Dr. Delany has this thing. Well, you really should talk to him about it. And, that's what happens, because they see it, they know.